is the screen being shared?
Yes, looks good.
Okay, great. So thank you, everyone. As I mentioned, it's a pleasure to be here. My name is Sarah Dury from SaniPath International and Emory University. Thank you to Michaela for inviting us here with the FSMA Spotlight webinar and for introducing us with a great introduction. So as she stated, our topic today is using the SaniPath tool for fecal sludge management and pathogen detection, and we'll give some examples specifically in the context of cholera. Okay, so in our agenda today, we'll discuss the following topics. So a quick introduction, and then we'll get into what is the SaniPath tool, and using the SaniPath risk assessment tool to identify pathways of exposure to V. cholerae. And then we'll have a question and answer session. Okay, so first I'd like to introduce you all to SaniPath International, our WASH technical consulting group under which the SaniPath tool now lives. So the SaniPath tool and the case studies that I'll refer to in this presentation were developed by our team at Emory, but we're excited to start this new venture with SaniPath International to sustain the tool. So at SaniPath International, our motto is using real-time evidence to make the greatest public health impact. So SaniPath International, as I stated, is a WASH technical to address the urban sanitation crisis and strengthen evidence-based decision-making and public health interventions. So we really acknowledge the critical role of data in guiding effective interventions and public health policies. The scarcity of accessible data on sanitation challenges often leads to policy interventions without sufficient evidence. Through extensive research and advanced analytic techniques, SaniPath International bridges this gap, providing data-driven insight that informs impactful sanitation initiatives, while also empowering policymakers and stakeholders to make evidence-based decisions for improved public health outcomes. Put simply, our goal is to lower the barriers to using public health data for decision-making. So this venture was started off, as I mentioned, by staff at Emory University with the collaboration of Trend in Ghana. SaniPath International leverages the extensive experiences and resources from Trend, as well as the Center for Safe Global Water and Sanitation at Emory University. So our team's academic background and foundation, combined with our experience with real-life application of rigorous assessment tools, such as the SaniPath tool, but not limited to, puts us in a favorable position to work at the intersection of practical solutions, driving evidence-based sanitation that positively impacts communities. So our team of experts from the United States and Ghana have been working together since the inception of the SaniPath tool in 2013. So our areas of expertise, we are a team of experts with over 10 years of experience translating results to action at the intersection of WASH and public health. Our technical expertise lies in using risk assessment tools like SaniPath, environmental surveillance of pathogens, health communication and education, intervention design and implementation, and more. So now I'll move into discussing about the SaniPath exposure assessment tool itself, which we call the SaniPath tool. The tool was developed with the funding of Bill and Melinda Gates Foundation, and piloting of this tool started in 2013 in Ghana. Since validation of this tool, it's been used in several countries around the world. And I'll start off with a little bit of background on the rationale behind the SaniPath tool methods. So to start off, it's important to think about excreta and how individuals are exposed to it. First, we know that excreta is not often contained. Many of you have probably seen this type of shit flows diagram, SFD, that looks at various depths along the sanitation chain from containment, emptying, transport, treatment, and reuse disposal. This particular example is from Dhaka, Bangladesh. And at each step of this chain, the excreta may be safely managed, which is shown in green, or the excreta can be accidentally or deliberately discharged into the environment, which could include residential environments, drainage systems, and surface waters. So our exposure assessment work and the SaniPath tool focuses on what happens to that 98% of excreta or fecal sludge that is inefficiently treated or not treated at all prior to being released into the environment. Where does it go? How do people get exposed to it? What are the public health risks from excreta in the environment? What do public health authorities need to know in order to effectively intervene and protect public health? I apologize that there's some formatting issues here. But we recognize that inadequate sanitation leads to multiple pathways of exposure to fecal contamination. So as we think about fecal contamination of the residential environment, we realize that there are many different types of exposure pathways. Most of you have probably seen this or some version of the F diagram that shows sources of pathogens in human and animal excreta and how these pathogens enter different compartments of the environment, and then how food, drinking water, and hands can become contaminated with fecal pathogens and serve as vehicles for transmission to other humans. As public health practitioners, we try to develop and implement interventions that aim to block these pathways. Interventions like sanitation may contain human fecal feces, and we think of these as upstream interventions. And as we think of downstream interventions, we're thinking about looking closer at the point of exposure. So as examples, improving quality of drinking water, improving food to reduce ingestion to contamination, including improving food hygiene, or improving water accessibility and promoting hand washing. So here I'd like to think about talk about what we think of as our dominant pathway. So we define the dominant pathway as those that make the greatest contribution to total fecal exposure. So the figures on the right show that pathways contribute differently. You can see pathway A, pathway B, pathway D, pathway C. And so the pathways contribute differently to total exposure. And reduction of a pathway may have, as you can see in this top example, reduction of pathway A, removal of pathway A only made a small reduction in total exposure. But if we look at the bottom example here, removal of pathway B, which we would call our dominant pathway, as you can see from the size of the arrow, has made a bigger impact on total fecal exposure. So this slide illustrates the different pathways of exposure to contamination that we examine in the SaniPath assessment. Some of these exposures are through direct ingestion, such as drinking water or eating raw produce or street food, while others are indirect through physical contact with flood, surface waters, shared latrines, open drains, bathing water, soil, surface water, or flood water. Fecal exposure from each pathway can be compared through a common metric of E. coli units, MPN or CFU per month. So what are the expected impacts of sanitation interventions? Essentially, reduction of fecal contamination in the environment should give us less exposure to fecal contamination and enteric pathogens, and essentially less diarrheal disease, less helminth infections, less EED and stunting. But is this what really happens? We know from some recent results where several intervention trials expected health outcomes that were not observed. So did these trials actually reduce exposure to fecal contamination at all? Or did they reduce exposure enough to make a difference? So the SaniPath tool really focuses on these two center boxes of exposure assessment. So really getting into the tool here, the SaniPath tool is a novel approach to support public health evidence-based decision for urban sanitation policies and investments. The the SaniPath exposure assessment tool is designed to assess public health risks related to poor sanitation and FSM, raise awareness about these risks among stakeholders, and help prioritize investments based on the exposures that have the greatest public health impacts. The tool allows users to quantify human exposure to fecal contamination in low resource urban settings through a systematic yet customizable process. As I've mentioned moments ago, this tool was developed by a team of public health experts and researchers at Emory. So this tool really uses a standardized and simplified method for data collection. The process of using the protocols are outlined here in this chart. So it starts with a preliminary assessment, which includes key informant interviews and transect walks to really better understand the context. And then the tool guides you through behavioral and environmental data collection and ends with a automatically generated risk profiles and a final report. And the SaniPath's tool interface is used to manage collection, analysis, and reporting. So this is all automated. So the tool collects two types of data, behavioral data and data on environmental fecal contamination. So data on behavior is collected using surveys of reported frequency of specific behaviors of adults and children that may lead to exposure to fecal contamination. For example, the type of water that people drink, the frequency of contact with open drains, or the frequency of using a public latrine. On the environmental fecal contamination side, data on the location and magnitude of fecal contamination are collected by taking samples from each relevant exposure pathway. And these are then analyzed for E. coli, a common microbial indicator for fecal contamination. The data is then combined to estimate the relative risk of exposure to fecal contamination. Okay, so I want to show you how the data from each part of the study is combined to provide an estimate of exposure for a population. So on the left, the behavioral data from household, school, and community surveys. And on the right, the environmental data from laboratory analysis. In addition, we also have other parameters from literature and other studies that are combined to provide an estimate of the dose of exposure and percent exposed in a population. And then we have the results, which are these people plots. So featured in the center, you can see that there are two components to this plot that I'll explain. So the first is the proportion of people that are exposed. And this is shown by the number of red figures. As you can see, some are red and some are gray. So the number of red is the proportion of people exposed. And the dose or the concentration of E. coli per month ingested is represented by the darkness of the red. So this will become more clear when we compare across some more, where you'll see some differences in the color. So here, this slide highlights the people plots shown that we can compare. So here within a single community, you can use the standardized data to compare different pathways. As you can see, municipal water, flood, drain, public latrines, and uncooked produce. So for example, you can see that in public latrines, the color of the red is very faint. And so we know that the dose here is relatively low. The dose of exposure to the dose of E. coli is relatively low compared to the other pathways. You can also see that drinking water and flood water have a much higher proportion of people exposed than produce or public latrines. And then just coming back to the tool and how it works, the tool is all on a cloud-based platform, and everything is open source and freely available on our website. So this includes the tool, protocols, and guidance on how to use the tool. So this map here highlights where SaniPath deployments have taken place. Most of these here, so you can see we have 12 countries, 14 cities, 57 neighborhoods. The units that we normally do these deployments is at the neighborhood level. Most of these were done with the help of the SaniPath team, the technical assistance of the SaniPath team. However, there are some cases where individuals are using the tool independently of the SaniPath team. I'll also mention that we have started to use the tool in more rural areas, for example, in Ethiopia as well. So it's also been modified for more rural areas. And if you're interested, you can also compare data from our SaniPath deployments. So on our website, we have our results dashboard where you can compare across cities, neighborhoods, and pathways, which I think is very interesting. So as you may be aware, there are many different types of tools that have been developed in the sanitation space. This recently released article by Dr. Furlong and colleagues at IHE Delft compares some of these sanitation tools. And I'll just quote from the abstract. Although impact will take time and it's difficult to directly attribute impact to a specific tool, evidence of the impact of FSD and SaniPath was found. So with that being said, I'll move on to some case studies where you can see some of that impact. So here's a quick snapshot of the case studies that I'll talk through today. I'll discuss 3 different deployments. So as this should be, oops, excuse me. Oops. Okay, so this should actually be Accra and Ghana, Kumasi, Lusaka, and Nairobi, Kenya. And I just wanted to highlight that in the Ghana and Zambia cases, we did the standard methods of testing for E. coli. But in Kenya, we modified and used a SaniPath approach. So still thinking about pathways and behavior and essentially using the SaniPath methods, but also testing for V. cholera using PCR. And I also just wanted to kind of highlight here that you can see the dominant pathways, they vary across, they differ usually between adults and children, and you can see that they're also varying across contexts. Okay, but before we get into more detail about these cases, I'll share another method that we use to communicate our exposure results to stakeholders. So these are called tree plots. So the darkness in the box here indicates the level of fecal exposure through a particular pathway. And the dark indicates the dark red indicates a higher total exposure and greater contribution of that pathway to total exposure. So the darker the color, the greater the total exposure. The size of the box, so in this case, you can see there are different sizes on the bottom left. So the size of the box and the percent indicates the percent contribution of each individual pathway to total exposure. So dominant pathways that are Dominant pathways, again, are those that contribute the most to total exposure. So for this example up top, you can see that street food alone is the dominant pathway. But in the bottom left, dominant pathways of exposure include both drinking water and street food. So take note of the difference in color as well. All right, so for our first case study and for the rest of them as well, I'll use the tree plots to kind of go through some of the results. So for this first case study, I'll take us to Ghana. The SaniPath deployment here it was conducted in both Kumasi and Accra. So you can see Kumasi is on the left and Accra on the right. The results for Kumasi show that for adults, open drains were a dominant pathway for most neighborhoods, with an exception of Moshi Zongo, which produce was a dominant pathway. And for children, you can see that open drain was a dominant pathway across all neighborhoods. And then for Accra on the right, we see that produce is a dominant pathway for adults in both neighborhoods. And for children, we see both produce and open drains. And I do see a hand raised, but I will maybe hold questions until the end, and we can come back to any slides for reference if needed. So what is some of the impact of these results? There have been some short-term and long-term decision and actions taken by local authority based on the evidence generated by SaniPath deployment in Ghana. Some of the immediate action taken includes hygiene behavior change education in local schools. Also the immediate shutdown of a public toilet that was desludging directly into a local river. And some long-term actions are focused on planning and policy interventions, and these include ongoing investments for fecal sludge management. For example, the Kumasi Metropolitan Assembly received funding and really based their interventions on SaniPath evidence to develop a food safety and quality compliance intervention. Additionally, SaniPath is now a recommended plan tool by the Ministry of Sanitation and Water Resource in Ghana. So in the next case studies I'll share, they'll be in the context of cholera and how we've used SaniPath risk assessment tool to identify pathways of exposure to Vibrio cholerae. As I'm sure many of you may know, there's been a pretty dramatic cholera outbreak happening in the last year. So since the beginning of the year, at least 24 countries have reported cholera cases around the world. And during this same time period last year, 16 countries were reporting cases of cholera. We also are seeing that mortality associated with these cholera outbreaks is of particular concern, as countries are reporting higher case fatality rates than previous years. So cholera is definitely an area of concern. Oops. Okay. So now going on to our second case study in Lusaka. In the case of Lusaka, 2 deployments were done to cover both the dry and rainy season. And the rainy season in particular, and here in Kanyama, this was during an ongoing cholera outbreak. So in this far right here in Kanyama, you can see that there was shallow wells for adults. That was the dominant pathway. This was different for children on the bottom. You see floodwater and open drain and raw produce. But this shallow well result was very insightful. So what was the impact here? In this case, the results from the SaniPath assessment tool really reinforced the efforts of the local city council to fill shallow wells. which we saw were a contaminated water source for a contaminating water source, and therefore hopefully would make a reduction on the cholera outbreaks. So I do just want to say again here that even in this case, we were not testing for cholera, but we used the results from E. coli and made recommendations on exposure based on that were useful in the cholera outbreak. And then this third case study here, this is where we did actually test for cholera as well. So this study was aimed to assess the exposure of fecal contamination and specifically Vibrio cholerae in residential environments in existing and newly identified cholera hotspots in Makuru slums in Nairobi, Kenya. And so we mapped hotspots based on the history of cholera cases in specific neighborhoods. We used the SaniPath exposure assessment methods to detect most dominant pathways for Vibrio cholera in the environment. And we also used satellite mapping, population density, wash services, and on-the-ground mapping to map hotspots. So I'll note here that these results are preliminary results for the Nairobi case study, but we wanted to show what we had so far. So in these results here, you can see that we had a variety of dominant pathways, and they varied a bit across across neighborhoods. So in Reuben, from contribution from high to low, adults, street food and produce were the dominant pathway, and children, street food, produce, and surface water. And for Njenga, we had adults with produce, street food, drinking water, and surface water, and children, surface water, produce, street food, and drinking water. It's a mouthful. But essentially, there were many different areas of concern. And again, noting that these are preliminary results, this is just the environmental data. So the difference between this and the tree plots above is that the tree plots include the behavioral data. But here you can see sample percent positivity for Vibrio cholera from the study sites, from the samples that we collected from. So some of these might be more obvious that we would assume cholera could be, but where things got really interesting was to see it in things like produce and street food and drinking water and shaved ice as well. So as we saw in the slides above, the dominant pathways were contaminated street food and produce that were of interest, and also contaminated surface water and ingestion of contaminated drinking water. So these results were useful in thinking about effective interventions in this context. The oral cholera vaccine interventions that were used here were the oral cholera vaccine, targeted public health and education and health education that really was based on the dominant pathways that we saw. So I think this is where the tools data can be really useful. And also provision of point of use water chlorination and improved water storage. So here on this slide, I wanted to talk a little bit about the SaniPath tool and how it differs from what we might know as environmental surveillance, especially in the context of looking for cholera in the environment. So when we think of the SaniPath tool, we're really thinking of it as a risk assessment tool. So this helps us understand really how are people getting exposed, what are the transmission routes, and what are effective interventions to respond to it. Whereas in environmental surveillance, we're really looking more at, how big is the problem, where is it, and what are the trends. So we really believe that the SaniPath tool and risk assessment tools are a complementary tool to environmental surveillance to really get to the bottom of of some of these outbreaks that we're seeing. All right, so in summary here, SaniPath International can provide a variety of technical assistance support at the intersection of WASH and public health. The SaniPath Exposure Assessment Tool is a powerful tool for FSM that can be used to generate data for evidence-based decision-making. And the tool has also been modified to be used with pathogen detection such as cholera and can be complementary to other types of surveillance. So with that, I am at the end of my presentation, but wanted to open the floor for questions.
Thank you, Sarah. That was a great presentation. Thank you
you
so much. Yeah, we saw a hand raised from Edith Nasanga. Edith, if you want to ask your question, please feel free. And if there's anybody else with questions related to the SaniPath tool or related to SaniPath International, or please feel free.
Hello.
Hi.
Can you hear me?
Yes, I can hear you.
Yeah. Thank you very much for your nice presentation.
Thank you.
In Cox's Bazar, Bangladesh, in the world largest refugee camp. So greetings from Cox's Bazar, Bangladesh. I have some questions. In the first slide, we saw that the SaniPath diagram. On the second row, I think it would be good if you can share the second slide of the presentation. Then I think it will be clear for everyone.
Sure. So, are you referring to this?
Yeah, the previous one, actually, the whole SaniPath diagram. No. The first one that you have shown.
So this is
that one. Yeah.
okay.
Yeah.
Diagram.
Yeah. So in the second row, my question is, as you know that we are dealing with the FSM activities. That means the latrine in Cox's Bazar. Actually, we are collecting the sludges from the latrines, and we are treating the sludge in the treatment plants. I mean the FSTPs. So, do you think isn't it important to add the fecal sludge field lab on the sanitation chain on the second row before disposal or reuse? After treatment and reuse and disposal, in between, I think it would be good if we, isn't it important to add the FSFL, I mean the fecal sludge field lab?
Yeah, so this diagram here is known as the ship flows diagram, which is a standardized kind of diagram where you can input a set of information and it helps give you an output of this ship flows diagram. So the standardized diagram goes in these steps, but I think it is good to think about, maybe what else we could be thinking about always that might be in between. So and the ship flows diagram is actually not developed by our team. It's a separate tool, but it's one that we find is a great complementary tool to think about before we start the SaniPath work.
Okay.
So yeah.
Yeah, thank you. And the dominant, I also saw the dominant pathways of the pathogen detection or pathogen tracking. In Bangladesh, actually, where we are actually the climate issue, the climate is not what we can say. The monsoon is the very frequent seasons in Bangladesh, and also the sewerage system, the drainage system is not well enough in the urban area as well as in the rural area. So in Bangladesh, specifically the areas which is located in the flood prone area, we experience that during the flood, during the rainy season, when the massive flood occurs, then at that time, the households which are located, which is the first floor of the house or in building or any one-story building, the floor is inundated frequently with the flood water. So in that case, the whole all the rooms of a household or shelter is fully inundated, including the kitchen and the toilet. All are inundated with the flood water. In that case, people are just cleaning their house with the fresh water, but it is not directly. It is not disinfecting the floors where we are preparing the foods and where we are serving the food. So I think it would be good also if you can consider the kitchen rainy season, the seasonal impact on the households as well, where the households are frequently inundated with the flood water.
Yes, thank you for that comment. You know, in some contexts, we definitely have considered seasonality and tried to sample across both rainy and dry season. I can picture what you're just describing with the flood waters coming into people's home, and we in many cases have seen flood water as a dominant pathway. And just on that note, I think as we think about climate change and evidence, I think that the SaniPath tool and the evidence generated through it can be really effective in advocacy by showing that, look, flood water is where, in this case, during this time, people are getting exposed to fecal contamination, and we can see that in this data. And sometimes it takes showing the data to advocate for more funding or advocate for other public health related interventions. So I agree, and we've also seen that floodwater can be a dominant pathway in different contexts and in certain seasons.
Yeah, thank you. And one last question from my side. Sorry, I'm I'm asking a lot of questions.
No
So
problem.
this is the last question from my side. And what do you think how we can utilize this SaniPath mechanism in the emergency context? Like as you know that in Cox's Bazar we have the largest refugee camps, and during the influx we actually experienced a huge impact on the environment as well as on the public health. How we can, if there is any such case in the coming future, how we can actually utilize this on the emergency context?
Yeah, so we have been starting to think about how to modify this for the emergency context. I know there is a project now that is using SaniPath methods in emergency contexts. I don't know if any of my colleagues that are online now would like to talk more about either that, but I think that yes, the SaniPath tool can be used, you know, in short in the emergency context, and I think it can be a quick way to see a snapshot of dominant pathways in that environment. But I do want to just invite if any of my colleagues have anything to add on that. Welcome to join.
Sarah,
Exactly.
hello, Sarah. Yeah, so currently the IHE dealt in a very big consortium involving about 10 to 15 organizations. Is implementing the SaniPath tool in Cox's Bazar and also in Uganda as well, in some emergency contexts in Uganda. So yes, truly, it's something that the tool is being explored in that direction. So I think it's early days yet. We've not seen the initial studies being done yet, but then there's an ongoing work both in Africa and in Bangladesh at the moment. Yeah, there's a very huge consortium of almost 20 organizations involved in that work. Yeah, in Cox's Bazar and Uganda areas where this is being done. Yes.
Thank you.
Okay, thank you very much. Thank you very much. Yeah.
Are there any more questions from anyone else? Thank you for your questions, Mr. Chowdhury. One of Sarah's team members sent a link in the chat box for more information. But are there any other questions? Don't be shy.
I'm saying this is Edith.
Oh, hi, Edith. Please go ahead.
Hey, well done, Sarah.
Thank
Okay,
you.
my concern, I'm from Uganda,
Mhm.
and I've been interested in the presentation about the machine, the tool to be used. But in Uganda also we have different challenges with fecal sludge management. And we would like at least, I don't know what I can say about it, but we very much need to get in touch and see how at least we can get that tool, also test our fecal sludge, because the way we handle it, for sure, it needs a test.
And Edith, may I ask where in Uganda you are?
I'm in Kampala.
In Kampala.
Yes.
So we have actually done a SaniPath deployment in Kampala. I'd be happy to share those results with you, but also more than happy to connect to see if there's any way that we can support you if you would like to do a deployment as well. But we did a deployment with in collaboration with KCCA and Makerere University in the Kampala area, and this was in 2018.
Okay.
So it might be interesting for you to see, you know, what the dominant pathways were in the case of Kampala. But again, we would be happy to discuss further with you to see if there's any use of the tool.
Okay. With me, I'm within Kampala, but I'm an entrepreneur handling fecal sludge. I have a company. So like I was concerned because of the company, but at least if you have ever approached with KCCA, I think you're there. Like but still I need to interact more with you.
Yeah, I'd be happy to, and I'll make sure to leave my my email in the chat box. And actually, let me just, while we are closing up here, I can just leave this here. But yes, feel free to send me an email and I'll be happy to connect.
Okay, please.
Thank you.
Okay, last chance to ask questions. Oh, Flavius, please.
Yes, good morning.
Morning.
I'm Kamwani Flavius from Blantyre City Council, Malawi.
Hi, how are you?
I'm fine. Apologies for joining in a bit late. I joined while in the middle of a presentation. However, I've noted that some of the issues that you've raised, especially in the concluding remarks, are very pertinent to our situation here in Blantyre. My raising the hand is to ask you if you would share the presentation at the end of everything, so that maybe I can follow on whatsoever was discussed before. Just to also mention that in Blantyre here, we did an SFD in around 2018, and I believe we needed to have it updated now. So I don't know if you can assist in having us update our SFD, and also looking at the fact that we've just secured the resources from World Bank, under which we are implementing a water and sanitation project for the next 5 years, effective this June. And that will also be a good tool to act as a baseline for our assessments at the end of the project. So if you do assist in coming up with an updated sheet flow diagram, that would be much appreciated. And also, if you do also assist us in data collection using the tool, because you might be aware, if you follow issues in Southern Africa, that Blantyre and Malawi in general was heavily hit by cholera. in the last 12 months.
Yeah.
We have the figures have gone down now, but we anticipate more in the rainy season, and also looking at the status of our fecal sludge management infrastructure. We still feel that we have not done much in as far as preventing another outbreak is concerned. So we would be very much happy if you would come in and assist us in coming up with reliable data so that we able handle the situations when they come. Thank you.
Yeah, thank you so much. We've been trying to keep an eye on what's going on in Malawi and understanding that there's been a very large cholera outbreak there. So, we would be happy to and would love to use these tools to help in that context. So please send me an email, and I'd be happy to share the presentation with you and continue conversations on how we can help you right now and collaborate.
Okay, thank you. Okay, we have just a few minutes left until we close. So if we'll take one more question. Any more questions? We'd love to hear from you. If not, we will begin wrapping up. And I want to say a huge thank you to Sarah. Thank you to SaniPath International. Thank you for this really, really insightful presentation that I just knew that people would engage with and would want to know more, and also would want your assistance in their context as well. So this is great. You guys are doing amazing work. Please keep going. And yeah, as I said in the beginning, this presentation will be available, well, this recording will be available in about 3 months' time for everyone to see, but will be available to FSMA members like now. So if you want to become an FSMA member, please do join us. But yes, the next installation of FSMA Spotlights will be in September. So if any of you would like to host a webinar with us, please do reach out to me. I will leave my email in the chat box. But yes, thank you again to you, Sarah. I hope I hope you had a good time presenting today.
Thank you so much for having us. And on behalf of our whole team, again, there are several members of my team here: Surja, Raj, Habib, and Atto. I believe just the 3 of them are here. So on behalf of all of us, thank you for giving us an opportunity to present this work here at FSMA Spotlight.
Pleasure is ours. So yes, thank you everyone for joining. I hope you found this session useful, insightful. Please do keep in contact or keep track of SaniPath International's activities. Please visit their website and just check out their activities. And yeah, thank you for joining us. Have a good day, have a good morning or evening, wherever you are in the world. And we will see you for the next webinar in September. So yes, goodbye and thank you. Okay, it's time. I'm gonna let people in now. Good luck, everyone. Good morning, everyone.
Good morning.
Sorry, I'm gonna ask everyone to stay on mute during this presentation. Thank you for joining us this morning. We're super excited to have this webinar with some pretty awesome innovators. So please, we're just gonna wait for more people to join, but please introduce yourselves in the chat box. Tell us your name, your profession, where you're joining from. The chat box is your networking tool, so please utilize it. Tell us where you're from, where are you joining from this morning? We're just gonna wait about 5 minutes before we officially start. But yes.
Hi, Michaela.
Hello, Ragun. Sorry.
It's okay. Can I send the background in this chat box so everyone can use this background? I mean, the Zoom background.
Sure.
Yeah, I think I will send the Zoom background in this chat box. Is it okay?
Okay, okay.
Okay. Did you get it in the chat box?
Yes.
Okay.
Okay. We're just gonna wait for more people to join. If everyone can just introduce themselves in the chat box. Don't be shy. This is your networking tool. We're gonna start in about 3 minutes. We have some young innovators from Indonesia joining us this morning, sharing their amazing designs. It's going to be a good one. We'll start in about 2 minutes. Just wait for a few more people to join. Oh, we have someone from Côte d'Ivoire joining us. Welcome, Côte d'Ivoire. Welcome. Thanks for joining us this morning. Were you at our conference? Were you at the FSM7 conference? Where else is everyone joining from?
Yeah, can you hear me?
Yes, but you can type it in the chat box.
Okay.
Thank you. Okay, we'll start in 1 minute. Great. Okay. Okay. Hello, everyone, and welcome to our monthly FSMA Spotlights webinar. Thank you so much for joining us this morning, this evening, or afternoon, wherever you are in the world. In this webinar, FSMA Spotlights innovative approaches to promoting sustainable sanitation solutions and empowering youth through technology. So just for a bit of background, in June 8th, 2023 this year, FSMA participated in the Indonesia Water and Sanitation Expo and Forum, which was organized by the wonderful Rugun. Rugun's here with us today. And this spotlighted young innovators. So many young people were very enthusiastic to learn about sanitation and to ask what they can do to participate in sanitation issues. So this forum provided a platform for young innovators from academia, industry, and government to exchange ideas and strategies on innovative approaches to promote sustainable sanitation and empower the youth. So as part of this forum, a toilet design competition was held, and there were 3 winners from this, and they particularly stood out. So in this webinar, we'll be speaking to these 3 winners, and they're gonna tell us more about their design, more about the context, and really just showcase their ideas. So, you know, as a sector, this is so important that we're listening to young voices, because this is the future. This is the future of sanitation. So I would love it if after this we can all just keep in contact with each other to exchange ideas, to see if there's any opportunities that we can give these brilliant young three people. So that's my little call upon the audience today. Please do get involved and keep in contact with these winners. Okay, so taking a look at the agenda, we have 3 presentations lasting around 30 minutes, and then we'll have a Q&A discussion at the end. You can put your questions in the chat box at any point during the presentation, and we'll discuss them at the end. Please stay muted and videos off during the presentation to avoid any background noise, as this webinar is recorded. So the webinar is recorded and will be available for FSMA members for 3 months, and then the recording will be available publicly like after the 3 months. So if you want exclusive access to these webinars, recordings, you should sign up to be an FSMA member. But I'm talking too much. Without any further ado, it's my pleasure to introduce our speakers today. So we have Raisa, who's studying at the Indonesian Institute of Arts, Yogyakarta, majoring in product design. Welcome, Raisa. We have Wika Mulani Fatima, studying at the Cultural Anthropology and Development Studies Department, Faculty of Social Science, at Radboud University in, I can't pronounce this, in the Netherlands. It's a city. Guys, I live in the Netherlands and I still can't pronounce half of the things here, okay? It's very hard. Dutch is very hard. But yes, that's Wika. She's in the Netherlands studying. And then we have David Suwarno, who's currently working as a GIS drafter for Urban Design Lab at Diponegoro University, Semarang. Okay, sorry if I pronounced these things wrong. But yes, those are our 3 speakers. So without any further ado, I hand it over to the SUTO team to begin their presentation. Thank you.
Thank you, Michaela, for the very brief and very clear introduction. My name is Wika. I will be the presenter for the SUTO team today. And I assume that my slide is already on the screen right now. And before I begin with the presentation, I would like to make a brief disclaimer that our goal in presenting this design and also in following this competition back then was really we didn't intend to introduce a very new novel technology that is super advanced, but rather we would want to show that there are fields or sectors, even in the water and sanitation sector,